got Danja Soeba. Danja Soeba, welcome to this hour's activity. May we see our hands so that you can recognize it. Please put your hands together to welcome the So let me use my left hand side for the commencement of the
wasu da dalilai sai san gode ne amma zuciya shi kana da ya ce a gaishe ku sannan kuma ya ce inda abin wata rana za a yi so zai zama da tare ya ce a gaishe ku sosai sannan yana neman goyon bayan ku sai mu ta kamar yadda aka yi can baya yanzu ma a ci gaba a taimaka wannan abu ne sa
who has a very vital role to play in changing the old narratives as far as routine immunization and traditions of the noble and humble prophet of Islam, Muhammad sallallahu alaihi wasallam, that duka mu makiyaya ne, kuma in the next world Allah zai tambaye mu abinda aka ba mu kiwo. Kuma we must account to it. Ko mu yi daidai ko ba mu yi daidai ba. Amsa ta rage gare mu. Coupled with the effort of the first administration in the country, where the National Health Act was signed into law by Mr. President, that every Nigerian has rights to access medical care without hardship. And each and every child that is under us has a right to be immunized. There is no way that this child must have access to health care services, and the services including immunization services. And no religion says, no religion is against immunizations. So what we gather here today is to rub mind with members of the media to see how they can come in to change the old narratives where women in our houses were left with our children to go to the hospitals, to get immunized, and to access other services. Now, the task before us is how do we mobilize men to support women in order to take their children to the facilities or to avail them to the health personnel to receive immunizations. And the health of our children, whether we like it or not, is part of our well-being. So without wasting much of the time, I want to invite the state health educator, Kabir Danja, Kurya, to give us a brief on the objectives of this meeting. May I invite Kabir?
I think Mala Abina Ali have already given us the objective of this meeting based on what you have explained. And you have explained what is in my mind based on what has happened in Kano during our mainstream workshop, which you are part of the meeting. That's why you are able to explain more. So, this is our usual routine meetings. We have been having these meetings, and if you can recall, for those who are around during our last meeting, we have promised that we will continue having these type of meetings periodically so that we can rub mind at the same time we mitigate appropriately the media platform in the state. One of the main reasons we are here is to give feedback on Papa LPA status done in the President 2023, which is going to be presented by after my remark. Secondly, we want to also identify some graphs why we are underutilizing our media platform in Zambia, because it's an issue. Based on what she will present, we will see the level of radio, the level of every platform, source of information, where there is some other, we expect that radio to be 100% or 80% or 55%, but according to the Papa LPS, I think it's around 5, and we understand that it's underutilization because we have the capabilities, we have the capable personnel in the state, but maybe we are underutilizing them as a result of some reasons. So we want to come up with those reasons. The third is to bridge those gaps. How can we bridge those gaps from now on so that we can improve as a source of information to the general public with related to maternal and child health in the state? If we are able to achieve this, I think we have done justice to this meeting. Thank you so much, sir.
Thank you, Madam Kabir. The next item is a good message, for which, but before the good message, I want to invite the Executive Secretary of our State Primary Health Care Board, Dr. Hussein Yakubu, to declare the meeting off. He is being represented by Malama Suwaiba, the Deputy Director of Administration.
So they were not supposed actually back in the name of the police now, they were also guilty of it. So they were little up to the same. And that they asked me, wouldn't out to you, back at the which they are about this about. You haven't said about it. Excellent, let's clap for this. When I asked my police, serious powers are what us do. You understand? When the master came for Kanikino, once some Maba is in charge, but a Jeva, I am my hour Gakafi, my hour Gakafi, she Maba, but I'm wishing for it. But Idenya Royala Lache Awaji Ba Ache, then gidan Kulu ne ko dan gidan Amina ko dan gidan Maryam, dan gidan Malam Kabiru ne, dan gidan Malam Husaini ne, dan gidan ko an taba faɗi haka, dan ana identifying din yaro the head of household ba identifying ko ina duk inda kaje ko wayannan ma da suka ce sun waye su da don't even need a man in their lives za su je makaranta ba yadda za su sa sunan su sai da su sa sunan uban su ma yaron su amma ba wai su ki. That means there's an authority that God himself has placed upon men as caregivers. So the responsibility is not just only authority, there's also responsibility. You have the power to do, you have the power to change. And Kuma, when it comes to change, I don't think change is optional. I think it's compulsory change. I don't think it's optional. So, why are we having these engagements? Because we know by the time you pick up the pen, they say the pen is mightier than the sword, right? By the time you pick up our pen, it goes far further than we expected. And now with the era of social media, and a program at TV is like a screen recording, I think I said I share it. When you must take a YouTube channel and even and share it, it goes faster. Sai ka ga kakannin mu da suke cikin kauye jikoki suna kawo musu ga abin da ke faruwa that don't even have access to internet or smartphones. So we know that this engagement with you will go a long way. Araba kafin dai mu fara magana presentation, so I want to talk about that. Not so laying foundation because I'm joining the two presentations together. I'm not picking the last round IPBs, like they say, last round data. I'm picking a holistic data of 2023, the survey that was conducted nationally. And we'll see the role of media, and we'll see who influences decision, especially in northern Nigeria. Of course, we have major three categories of people that influence decision. Oh, northern Nigeria, number one, Who are they? Okay, you say policy makers, traditional rulers. Thank you. Excellent. Because a politician can come and say, do this. If you don't belong to his party, you will not do. But traditional leader, everybody is under him, irrespective of your political affiliation, irrespective of your religious sect. You're under a traditional. And then the next we have is what? The religious leaders. We have lot and lots of respect and reverence for them. They introduce the light to us. They guide us on the right path. Isn't it? And then the head of households. Because idan abu ya gagara a cikin gida, ai babu magidanci da zai je gaban sarki ya gagara ya abin da sarki ya ce ko shawara da malami ya bashi. Ya taurara a gida ba zai ji ba. Or he could also listen to his own father, or the father of his wife, because father ne, baba ne, akwai wannan level of respect for us. Mu level din respect mu a north ba iya kudinka iya mutuncinka ba, a'a. Muna girmama iyaye, muna girmama magabanta, sarakunan mu da malaman addini. Ko ba haka take? So that is why I'm still reiterating the fact that we are sitting down together. Dan akwai matsaloli. Data ya nuna kafin yi presentation, dan nazo presentation din ba bata lokaci zan yi ba, we just sweep through it, but let's have this discussion so that by the time the presentation is there any question, we leave because of its Juma, and then I understand the importance of the Juma prayer. So, a lot of times women get overwhelmed. Yeah. Kafin sai dai za ta tashi suna zuwa kaga ko kai ne mai zanoyi daidai za ka gama za ka tafi sai ka ga supervisor din kai kira ka ce ga wani aiki dan tashiwan aikin nan yayi kaman anything that has to do with a child. So it's just 3 LGs that pass. So we're looking at the immunization. Okay, so I have immunization, only 3 LGs. Next. And then for our ILPs, okay, let's see the percentage. We have zamfara. So performance red, I think it's going to score for 57 to 60.
My name is Umar.
Okay? Then that means 7 LGs. Then 3 LGs, passing 4 LGs from 9. So we didn't do well. Next. So these are the LGAs that were prioritized. That were prioritized based on the cohort of LGAs that are consistently on red. Red, that is failing, and orange are possible reporters. From 2018, 2019, and 2023. Don't mix in the issue. Okay, one of these is so consecutively, and you'll be surprised, those of you to hear your LGA, Bungudu is one of them. And then Zuri, Magaji, Bokura, and Anka. So those are the LGAs for this survey. Ama aside the survey, Munsa survey is random sampling, but we have issues, especially in Buso. It's not new for media people that we'll be engaging with. We have issues, especially for Buso. Ubombaya so kumaya chibaya so kumaba abundeza ishia chibaya so. So you see, that is the problem. Next. Okay, reason for not immunized or partially immunized. Don muna da yara da an yi partially sun fara ba su kammala ba. Akwai wanda ma ba su ma fara ba. So what's the reason? Let's see. Okay, the highest one is vaccine is not available. Then the caregiver unable to take the child. I talked about when a female caregiver is busy and she couldn't take her child. So that's the second highest. It's not as if she doesn't want or she doesn't know the importance, but she didn't take the child. How you can and other things. She couldn't take the child. If she had support from her husband, of course, this bar would have gone down. Okay, it's clear by 12%. Then the third one is others, like generally there is no certified here. Then The fourth one followed by unaware of EPI. Unaware of EPI programs. Schedules. They don't even know Yoshe. So this lies on the decks of the program managers, even leaders should know when and when. And then what we are mostly concerned is mother or father forgot. Mother and caregiver forgot. So if the husband is in tune, sai tuna sheta oh rana kaza dan ya ga kati in an je asibiti in mai kula ne an je asibitin ya zo zai ce mu ga kati yaushe za ku koma in kuma ya gani da za su koma da barci zai ce to kin san gobe akwai komawa asibiti in dai shine ke bada iko a tafi asibiti izini sai ce to na baki izini gobe fa za ku koma asibiti you see he has reminded her ta manta abubuwa suna mata yawa shi ma abubuwa yana mishi yawa next next is a core area. The no felt need. Not unaware of the need for immunization. The matter of fear for side reactions, father's consent, for financial constraints. The child illness is another one. No felt needs like Babu Bukata. Place of immunization, security, no faith in immunization, vaccinators not available. So these are the reasons why children are either partially or they are not. Well, alhamdulillah, there's this 6 LGAs of 0 dose. When we say 0 dose, so the UNICEF is supporting for outreaches. For the outreach, our people still need that they still need us to give something. And in other places, there's a women group on Facebook. They were talking about water vaccine. They introduced it for us free. It's free for us. But when I was chatting, the woman said it's 18,000, between 8,000 in Abuja for Port and Lagos. That is not free. I said, no, it's free because I work with it. But don't forget the matter, since I can comment in me, Bana song I had social media, I only do somehow. For me, I think it's free. But look at our women asking me about for other women, other places, they are paying to access it. So I think the media needs to come into this so that they will understand the importance. We know you are the first step. So you are very key. You are very important. I was discussing with somebody this morning. I said, do you know that even the policy makers, they're always looking at the news, what is happening? Gossip, blogs, they want to hear, maybe their matter will come up. Because there's something they think they are doing that nobody knows. They just see it on social media. Bam! So they listen, your voice is strong. By the time you talk about all of those things, and there are a lot of people that are looking for that kind of interaction, so men can get to hear and pick up that they have to play. Let's see the next. So this is okay. We'll talk about the music. Next. Okay, sources of information. So these are the sources of information about RI services, not only RI. Please share with us what is the interest. Share with us. Okay, sources of information about RI services. Oh, where do they get? The one that is the highest is health worker. Oh, 2%. Followed by loudspeakers and town announcers. Then polio campaign vaccinator. Then what is it we do? Then we have family members, then community leaders, community mobilizers, neighbors and friends, mosque announcement. Television is 1%. 1%? Yes, sir. 1%. Okay, radio is the third, 5%. Radio is 50%. Radio is the fourth. 5%. of source of information. Radio is just like I said, this is a random sampling. I know our people glue to radio more. People watch, listen to radio more than TV. Yes. And then, except for the elderly that watch national TV, that they'll get to see news and all of that. Most people now, if you tune to always on Arewa 24. On Arewa 24, you don't have a program, except they have a program for immunization. But I'm sorry to say, some of our TV stations, they have boring programs, except...
But I don't know if this covers our people in the rural areas.
It does, of course. That's why we have 1%.
Yeah.
It's not everybody that has it. So when your denominator is high, what is the 80%?
Actually, it covers people in the rural areas. They do having the highest power.
But they have traditional leaders high. It's not every household that have radio. They use their phones. Is it every household that has radio?
But every station they use their phones.
Every household has radio. Do we agree? Do we have a data to back up the fact that every station?
What was on?
The information on radio.
Yes.
Do you have data to back up that? So anything like you have that.
So it's just an assertion. Just an assertion.
Okay, you know why I'm saying so? I'm not saying radio. It's not me, I advocate for radio. What I'm saying is that you cannot replace community leaders with radio. If radio comes ahead of community leaders, you should consider it. Because the people are closer to the community than even the radio. It's when you tune on the radio that you get to hear the information. Some might have the radio, they don't have batteries, they don't even have lights. So it's possible that radio was there. But community leader, once we send information, they will send to the people. It's gone. And it moves. Somebody will now validate, oh, I'm managing the radio and they get it to people. You understand? But then, once it comes like, and people validate whatever comes from radio, especially our people from rural area. Because you have radio, have radio, and let's have the one. I forget and never take it. They believe it. But then the community leader, of course, is closer to the people. One message about you send to all these who are in Kasa, and then they will pass it all. And then people will tell you, I mean, before they, maybe because my put the radio back in radio, you have validated. I'm surprised I didn't see newspaper. I'm not just every person. Don't that newspaper. Come on, message immunization and newspaper was just again a newspaper. So they say, tell them to report what they see. Okay, next sources of information. Okay, this is it. Let's see for zamfara. So the blue signifies which color? Healthcare worker, okay, it's the same bar that is represented, it's the same, it's just that they change. The other one was the other one, red. Okay, then another issue is cat retention. Adenan cat. Shi ma tana matsala da idan sobe sun zo gida. Abin da shaida an ba mu amma yaro rigakafi shine wannan katin, shine shaida. Ko kai yaya ka ce kai what do you call it? Ka gama primary school. Akwai wani case na wani yaro ne, wani mutum da nake ji a Abuja, a family. Ya je yin fatin shi ne fa kawai. Sunan shi ya haɗu da mutum wani criminal da yake ya fara shi ba criminal ba da sararo ko da ƙauyen Abuja ne. Shi ba criminal bane, an yi ya shekara 3 a prison har garin dukan shi ana yin su ba shi bane. So wata mata ne ta zo har abin ya sa ba shi da kowa sai mama ta. Mama har abin ya dame ta har ta mutu yana cikin prison. Shi bai taɓa sata ba ma. Amma an ce policing insist kamar wancan criminal ɗin ya kudu ne ana so a replace ne. I don't just know understand. So wata mata ta zo prison irin masu zuwa ziyara ne ta gan shi. She picked interest. Sun san idan time naka da Allah ya shirya maka yayi Allah zai tura na shi. Yes. So he came, he picked up, they got converse, ya ce shi ba sunan shi bane, sai ya ce okay kai makaranta ce, kana da certificate ina da certificate primary, an ka tura kauyen su, an ka ja ka ga sunan da yake faɗa shine sunan shi, shine yana certificate ba wannan da su police sun laka mishi kai ba. So you see that certificate has exonerated him. Ko inda babu ba shi da wani sai ai primary ya secondary. An ka je primary school din su an san shi da wannan sunan. Secondary school da ya je an san shi da wancan sunan. Before a je court amma ya wahala. Don ma ya yarda ya ansa wani police ya ce mishi ansa shi ya yi ko ba haka kashi zai nan ba mun kowa zai ce komai. Ya ce kawai don a kashe prison. Amma in ya sai yana ce ba shi na ba wallahi kashe su zai. Shi ne ya yarda ya ce shi ne. Amma dai na cikin prison in ya ga wani police ya ce shi ne in ya je kotu sai daga hannu ya ce ya ji wuya ne ya ansa wai shi amma ba shi na ba. To ba ma kai shi kotu ba daga police station sai su yi. Who will fight? Nobody will fight for you. And that's a man. Yes. Probably. So, hannu ya riga mutu kafa ya mutu ya zo ya ɓaci mota ne taya mota ne kawai a gidan. So that is it. So whatever the evidence you have, ko da mama za ta yi rantsuwa, please one house, ko da mama uwa za ta yi rantsuwa, ta kai yaro ta kira sunan malamin asibitin ta faɗa time da ta ce ta da wa'anda ta gani a asibiti katin nan ne kai shaida. So idan ba a jiyan katin ba kaman ba yi ba. So a cikin messaging ɗinmu kamar yadda na fara na ce iyaye maza sai su am I boring? Some people are dozing off. Am I boring? No. Please wake your neighbor if your neighbor is sleeping. Tap your neighbor if you are sleeping. And they say elders don't sleep, they say they meditate. Executive meditation. So some people are meditating. Okay. That is why when I started I did the foundation that parents in the class, especially, tunasar da su dinga goyon baya wajen goyon bayan ma in ka iya adana kati in za ta fi ka ba ta kati it's one of support, but let them come fully. In ana magana gender mainstreaming, I know most of you are experts there. Za magana okay, women and men like this. No, in this place it doesn't work. But aka Allah yayi ba. He has a reason why he has a plan. Exactly. What? But what a man can do?
She's used to the saying now.
It's a theory. But practically, did you see the military training? Have you seen the military training?
It's a theoretical observation.
Oh no, that's true. If you see the military, I am okay. I want to hear your voice say something. That's how I get your the same. Have you seen the military training? No, I'm asking. Have you gone to the military training and seen? Is there a time they tell you a different of the time? No, they train them. Hold on. Let's go there. Take example. They train them together. Yes. Yes. My sister knows what happened in camp. She called me. She was crying. I saw her video. They said the mother teacher. They said the mother teacher. Babu na mace da matan aure da ke wuri da wanda ba su zaura da zara da kuwaye su zo mutane su mai yadda sa suna da mata su da ya tsari. So it's all the same training. It's professional. And there is no in the professional. Then I said the role that God gave men to treat women as pamper us. What? Is to pamper us. Yawa, wani lokacin ne kuka gaza ma muka dauki cebur. Anyway, let's not deviate. For them, the men still are authority over us. That we cannot rule. You can't change the word of God. You can't change what God has placed. But it doesn't mean that if you are authority, that is why I like to if you are a head or your heart is ahead of you, it doesn't mean that hold on, one house. It doesn't mean that because you are in the office, your boss, you not tell your boss, female boss, you know I am the man God gave you. You're friend. Sure. Professionally, you don't. Why we're advocating for it is that in they don't consider women. They don't consider women. They just oh, no matter, let's just leave them. And then it's not as if women cannot contribute. They have their own quota.
They are inactive.
If you say they are inactive, I refuse because I'm a very active woman and I know that. My father knows that right from when I was a child. He told me that.
You are only,
and I know that.
you are only few.
And my husband is proud of me for
Only
that.
few.
Only few
Are the active. So we are taking a majority to carry the vote.
Yes. Okay. Reason for non-availability of child cards. This is the reason they gave us. Child never votes for vaccination is highest.
Yeah, we give vaccination, but the 70 times.
The next one is that 4% is that loss destroyed in space.
And I hear some, no matter how keep up. Sometimes go right na iya faruwa, ana iya kaura. When we are moving from my old house to the old, I lost my son's school. I don't know how I lost his school result card. Where she gets in books, I have to appeal with the school to provide another one because it carries the nursery, how it shows. So yes, so I have to. Kaura can cause something like this, and maybe the woman is packing. It's not what we celebrate. So back matula kati riga kila mahana kata fide yaro. So some of those things are some of the factors, not like what is funny? Okay, 0 dose. This is 0 dose. Children from 0 dose LQS. 0 dose. Here in the Bachuma Zamfara is the highest in the country. Remember, this is not my data next. The highest, and then I think the LGS with 0 dose. If I can remember, let me not give you the wrong thing. Then that's the next thing we see on air. I know we have 6, but then partners are coming in to ensure that they intervene. And then sampling. After community in the year on the back, because the herd immunity, I always like to remind us of what herd immunity is. The herd immunity is weak. So eventually, but if the herd immunity is strong, I hope you understand. So she is up, and then we have those 6 LDAs. She is up and sack as well, but it's not the raining one, it's not the raining uncle. How can she's been discouraged? Was that as well? Why? There's a root cause. But we saw many damage and the lady, but an associate survey, ties to suka, ties survey, Tadaka, Shikila Mate do, Kafantafu. The Share Gidate when you and Kate, Kafantafu. So, but if we have the male that support, there's nothing wrong if a man carries his own son to healthcare center to collect for RI vaccination. There's nothing wrong. Idan namiji zai tafiya sai ya bada baki. In ba ni nan duk abin da ya shafi harkar lafiya in an zo ki bada yaran nan. Is that not? Kuma babu vaccination da za a yi ko healthcare service da za a kawo da ba sai an hada da malaman addini da uwayen kasa ba. Nobody just jumps from the sky and start punching our children without the consent of the government, religious, and even community groups in the communities. So, maza muna da wannan haki. So, why am I saying this? So that idan kuna creating content, messaging, you pick up those points and include it in your messages. Maza akwai aiki. It's not enough to just get a woman pregnant. It didn't stop there. Some pregnant women, chicken yana zuwa da laulayi. How do you support them? Za a ce ai mijin I don't think it's haram. Is it haram to help a woman to sweep? Sweep. She da miji ne, he cannot sweep. Amma yana shagon ladi mai tuwo yana wanke kwanukan customers. So what difference does it make if you wash your wife's plates? Saboda Allah. Amma muna dan jin kunya ne. Shi bayan sallah su ba ku wanke kwanuka ku kife kafin kowa ya fito. When we can support in our own ways. Wani cikin yana zuwa da laulayi sai a ce da gangan take yi. You can support in your own way. If you cannot do it, hire a maid in kana da hali. Ka samu mata mai aiki. ko kuma in kana da sister da za ta iya taimakawa, you see you are supporting. Ko kana da wata da za ta iya taimakawa, you are supporting, but at least so that she will have time to go for that vaccination, or you can take the child for vaccination. The first man I saw in Sokoto, I was no go. When I said, are you from school? The only man I saw, ina gani tun matan tana da ciki, ina ganin shi yana kawo ta asibitin Arkilla, yana kawo ANC, sai na gan su tare RI. Abun zan sha'awa. Except idan mijin yana zama a wani gari ne, yana aiki, so this is understandable. Gida ɗaya ta fita da safe, baka ma san yaushe wani rigakafi an ka ba ma yaro wanda za a bashi next ba. It's good as a parent mu sani, so that idan matan ma bata je ba ta skip, zaka tunashe ta rigakafi. Me, I don't know, but I think I'm not being trying to be biased. Kamar mata sun fi iya adana, dan naga ko certificate ɗinmu na primary school, ko da babata bata yi karatu ba, karkashin gado yake. Akwai yadda take adana shi. In an tambaya sai kaga an tutuye katifa, kaga ana fitar da su takardu. They have a way of keeping katin zabe, rigakafi, read school results, birth certificate, and other things. So, if that is the case, if she comes back from the clinic, people ask, Bugakati, ni Ankabata, Kremakasan, what the Garafi Nankabaya, what the Kariya came from Yaro? What the Kabashina, what the Kariya Bash? He never missed me. So, as a parent, a male caregiver, we should understand it. And I'm saying this, let's start with us. Let's start with us. Let's not be looking at what I'm doing. What are people talking? Are we doing? Are we listening? Is it like an awakening for us? And that's the and of course, by the time we do it, our younger brothers will see it, follow it, and then our neighbors. When halaya kamar ya ishe mutum wa'azi, ba sai ka buɗe baki kama mutum wa'azi. Some steps that you are taking that is on the right path. Sai kaga mutane, some will laugh, of course. You expect that because your level of exposure and yes is different. Amma a hankali. Za a zo a zama. Ko ba haka take ba? A hankali, akwai abin da da kana yi, ana maka dariya. For example, da mutane da ke tura yaran su makaranta, ai dariyan su ake musu ko? Amma yanzu uwaye ma da kansu suke fito ba ta yaron makaranta. Just nemi kuɗin su ma su ɗauka suke makaranta. And then this education was free then. From the stories we were told, remember I said it was free. From the stories I got to hear. And then some people will laugh at you. Oh, in the Engidan Boko, they'll just laugh at them. Amma everybody will want to say that yaro je boko a koda secondary ne. Dan da idan an kawo sika, head teacher na makarantar na ya sa asirin kowa shi ke karantawa, shi ka rubutawa. Is that not? Ni na koyar rubutun Hausa dan ina da aunties da basu je makaranta ba, su rubuta mu koyar da su. Ina fara su letters. In an tura musu su kawo letters sai karanta. In za su tura sai ni in sake rubuta. So I learned how to write Hausa before I learned how to write English, even though I'm not a Hausa woman. Although a corner. So let's look at the parents, the caregivers. Programs, we're targeting male caregivers. But let's start with us. So with this, I'll move into the presentation. This is the preliminary findings of integrated Papa LPS of the 36. I don't know why it's 3 FCTs. It's 36 states, inclusive of FCT. This is for second quarter. Yes, the third quarter is ongoing. Since suna kauyuka, suna wannan survey, because it's 3 times a year. So this is the second one that I'm doing. This is the outcome I want us to see. Let's focus on sources of information and who influences decision. So those are the 2 major things. In our anchorage, because everybody that sees the source of information, every donor want to pump their money where it's yielding more results. You all understand? In the Sarakuna, then they will support more of traditional. In the media, I wanted the Sako. What's the right word? Thank you very much. You invest on the person that gives you results, because everybody wants value for free. Next, quality utilization. This is the outcome. Oh, this is not right. Yeah, you have to have it.
Can we see, please?
Okay, out of the 14 LGAs, what? When it's the passing, general passing, from those specific part, we have a zamfara. The past one is the green line. You can all see. Actually, 14 LGAs are we issue. 3 LGAs go in the passing. Listen, 3 LGAs, what percent is that? But one up, whatever. 3 LGAs out of 14 LGAs. So, Papa LPS in the night, not even get when the Zambi Ganaki. Don't call you Tana Jeta Dow, the Jeta Dow, and I come and come the Itaba Gamma, and come and take a polio, the other country that only Angua. And after 2 years today, in the last meeting, the Muke, the social mobilization, as I got on the status thing. Dana Faradish, some for a target about Juhu. Countries, what's country? Kasashe ko? Kasashe 23 ko 25 virus sun kullu. 23 ko? Ta transporting. Mu ba mu transporting gero mu ba mu transporting shinkawa ga mu da shi ba mu transporting dawa ba, amma mu transporting virus. So it's a global concern, and as I always say it in every forum, idan ka haɗu da mutane internationals masu aikin lafiya, in ka ce you are from Zamfara, oh, what are you doing about the ZAS? Because Anna mentioned ZAS 1. What is happening in the ZAS? What are you doing about the ZAS? And then we have reports that mutane suna zubar da vaccine seeding ga maki. Na san media akwai time da suka dauki wannan sun yi sanarwa sun yi an ja kunne abin da yayi dan sauki, amma ka san wani lokaci bugu guda ba shi ka kashewa ba sometimes. Ko ba haka take ba, wani lokaci bugu guda like it comes.
Hadid in ba mu zauna da ku ba muka fahimci juna. Za mu je mu ta bankaura muna zuwa muna yin program ga radio, alhali kuma abinda kuke son a gaya ma al'umma ba shine muke gaya musu ba. Amma ina akwai wannan na sha gaya muku, mu dawo da issue na program plan. Program plan is the best abinda zai solve din wannan matsala din. Ku kuna da matsalolin ku, mu zauna da ku mu ga okay cikin wannan kwata meye problems din ku. Sai mu hitar da mu hitar da programs din mu kan wannan. Akwai ba sai kun biya ba. Akwai muna da program din da ba sai kun biya ba. Za mu yi maku, kuna da kuma nasan inda aka fito akwai engagement da ake yi na media, na san akwai support da kuke bayarwa na kuɗi, akwai support da ake bayarwa na kuɗi da media outfit wanda ana maku drama, ana maku jingles, ana maku producing na programs. Ban san shin yanzu ana yi, in ma ana yi mu producers management din mu ba su tuntuɓa balle ma mu san me suka san mai masu haɗin kun gaya musu. Dan dori mu kuke kira ku gaya mu daga abin da kuke so, mu zauna mu hitar da abubuwan nan mu je mu yi su. Yanzu an bayyana wannan da mu, to kuma inda muke mu as producers honestly in ba a kira mu aka ce ga abin da ake so ba, mu kuma za mu kyale ku mu yi muku abin da mu muka ganin cewa shi muke son mu. So amma dai ina ganin a dawo da wannan issue din. Yanzu I believe ba ni kadai ba, duk aikin da ba a kira ka ba a ce zo ka yi ba, ko ka ga yadda abin yake ka kyale ka koma haka gefe, then maybe you are not interested ga al'amarin nan, so you should be silent ga al'amarin nan. So in kuna son a gyara, you know what I am talking about. So ku gyara, in ba haka ba the same problem za a ci gaba da samu, kuma the same thing media za ku ci gaba da samun matsaloli, don ba management kai muku aiki ba, mu dai producer din nan muka aikin nan dai. So muddin ba ku zama in close contact da mu ba, aikin da kuke tunanin ku samu gaskiya ba za ku samu ba. Abu na biyu, a yi haƙuri. Ina ɗan so in haska muku wani abu ne. Looking at the impact na religious leaders ga kowane al'amari, ina son stakeholders ku fara tunanin wani abu. Looking at the present crisis da yake faruwa a cikin jihar nan na religious leaders, gaskiyar magana in ba ku fara tunanin wani abu ba na fito da wani sabon salo da wata hanya na engaging din religious leaders din nan, so you will end up sakon da kuke son ya isa ba zai isa ba. Don to be frank and sincere, ni na riga na ɗauki an samu matsala tsakanin malaman addinin musulunci da al'umman ma jiha ba da gwamnati ba. Dan malaman addinin musulunci a nan jihar Zamfara yanzu, kamar da kika ce, idan ɗan siyasa ya ce ya abu, wani in ba fatin shi kake ba wallahi ko abin nan gaskiya ne ba zai yi ba. Dissenting ko malaman addini ne yanzu akwai wanda in ya zo ya ce abu wallahi tallahi akwai wanda ba zai yi ba, saboda dai kawai sun raba kawunan su sun ɗauki bangare na siyasa. Wannan abin zai ƙara taimakawa wajen samun matsala wajen isar da sakonnin su ga al'umma. Da haka ku stakeholder ku yi tunanin ya za ku hito da hanyoyin da za ku engaging ɗinsu wanda zai iya al'umma za su amfana. In ba haka ba gaskiya magana su ma sun rabu kuma sakonku ba zai isa ba. Assalamu alaikum.
Please, let's just summarize.
To kasancewa da lokacin sallah ya riga ya karato, kuma daga cikin jawaban da nake so in yi na ji Hajji Lawali ya dauko su. Illa dai abin zan kara anan shine Shamsu. Illa dai abin zan kara anan shine baya ga news production. Yawa baya ga news production yana son kullu ki haɗu da shi mai gida Haji Kabir, ku ba ni resource persons ko da mutum biyu in yi live program da su 1 hour idan Allah kai mu ranar Monday, ko kuma lokacin da kuke ganin za ku iya sanyawa sai ku tuntube ni. Wannan shine.
Thank you very much. I saw a hand here. Sponsor addressing. Okay, one house. Let me respond, and then I'll give Alhaji Kabir a chance to respond. I am glad we are coming up with this.
If there is one lady that wants to talk.
Any lady that wants to say anything?
I raised my hand.
You talk too much.
Somebody.
If I want to talk, they can't hold me from talking.
So are you talking of? Okay, so please, let's listen. I will just say a few things. So let's listen so that I can say what I want to say. We are distracting. I would want to say thank you for bringing up these issues. And I know how we work when I came to Zamfara. I think I started from Sokoto, and then I was a media focal person in Sokoto. So at this Lowly and a few others, we do meet in our engagement meetings. And then when I got here, I was glad that I have faces that I know. So response to media engagement is not just this meeting alone that is ought to be. Then we had funding from polio, that we have quarterly review meeting, we plan, and sometimes we do even field trip with you. But now funds are dwindling. So even this one, it's the last quarter that we got the fund for this one, for this very meeting. Aside from UNICEF, primary health care, I don't know if there's any, Alhaji Kabir is here, any organization that funds or supports media. Even from the primary health care, I don't know if they have a budget line, I don't think so. Solely is the UNICEF fund. When you see meetings like this, UNICEF is able to get some funds. But if you don't see, probably because UNICEF has no fund. Because if there is fund, definitely we would invite. That's why if I come for meeting, the faces I know, if I see a strange face, I'll ask from which media. Because I know people that work. That it's not just sit there in the meeting. After meeting, you see people sharing link with me, the stories they have developed. Some even send videos, a YouTube link and all of that. That's why when I see faces like this that I've never seen, I ask questions. Because you don't just come and sit down here, just talk and sign your name and go. It's not all about that. It's not just about representation. What do you do with the message that we sit in here for? And Lawali brought another point of program planning. I'm throwing it back to you. You coordinate with other media houses. What programs are you doing? You give us your time. Then we'll give you topics to be discussed. So please share that. I don't know. I know you have your leadership, but please, if you can lead the process with others that you work with and come up with your plans. We've talked about gender mainstream, male involvement in promoting healthcare services, RI, MNCH, routine immunization, polio, and all of that. Before I forget, before I pick another point, polio house-to-house vaccination is starting on the 14th to 17th of December. Please, I know there's going to be social mobilization meetings. Some of you are members, you'll be. So, poliomyelitis still remains a deadly disease that cripples a child and is irreversible. 14th to 17th of December, there's going to be the strategy is house-to-house vaccination with polio vaccine. Oral polio vaccine drops in the mouth for 0 to 5 years of old children. So it's targeting under 5 population of Zamfara. 0 to 5 years old are eligible for this vaccine. And we're doing this is because we keep having reoccurrence cases of polio variant in Zamfara. And Zamfara has given to other countries and other states. That is why we keep doing this back-to-back campaign, so that all the children that we have missed are vaccinated. They are mopped up, we are getting vaccinated. No child is left. Any child left is a danger for the program. So that is why we see us in schools, you see us at homes, you see us in churches, you see us on the streets. Anywhere we see a child, we vaccinate because of how important it is to have children vaccinate and build herd immunity. So if we are doing our messaging, let's have it at the back of our mind. There is, if you develop any story, if it is social media, please, we have the social media, we have our forum, right? It's still active. Drop your link there. Share it with your family and friends. Let them understand. Then thank you Gamji TV for giving us time. We'll talk it out with Alhaji Kabiru. But this your observation. If it's time for, you say, program producers in our next meeting, that means I think we should invite only program producers. If from your point, you are saying we should invite program producers, right? Normally it's two. You know, we invite. Sometimes the producer will say, "In one mayaji, I come So we are taking note of that. But if our funding will not take that, we will take from your organization. You will now decide. If you are the reporter that goes, should we invite reporter or we invite producer? If producer cannot come, we'll send reporter. When the reporter comes, he reports back to the producer. If we don't have the money for both. Let's agree. We don't have any forum to sit down with them again. There's no forum.
We don't need English to understand ourselves. Essence, we are here in as much you are from Zamfara, watching in Zamfara. It is your responsibility, whether with cash or no cash. That's what I want to know. But what I want to say is the
okay, thank you very much. I understand the point. So this 0 dose, it will be addressed. Thank you very much. Any other I left out? Let me hand over the mic to the Oga of the program. Me, I'm only here to support. He is the driver, I am the conductor. Oga driver, Bismillah. Yes. I said the driver. Who was no, I need.
One house, please. You have had a man from Kulu, and the expectation for the media is we want to use people to relate the upcoming to reflect the call on many households, male parents, reflect your stories. Reflect your stories as far as the upcoming campaign is concerned. Giving some emphasis on the need for male parents to support their wives in getting their children vaccinated, please. That is the expectation of the media. There is going to be an interview outside.
this human being going at it. Hopefully, all of us so please continue the patient. Don't die, follow and we will continue to provide. Sometimes they are handicapped. Just because somebody like this, actually you don't have to